Stanford scientists have detected a new COVID-19 variant that experts say has been found in wastewater samples in California. It comes as health officials are now restricting access to vaccines. COVID-19 is still evolving, and scientists are keeping close tabs on a substrain detected in China last month, now circulating in California. Doctors say the good news is this strain does not appear to be more severe, but it looks like it is more contagious.
It appears to be able to attach to the receptor sites on our cells more avidly, with greater ability, which may mean that it's more transmissible, which would not be good news.
COVID numbers have been low this year, but that could change as we head into fall and winter. Today, Health and Human Services Secretary Robert F. Kennedy Jr. removed the COVID vaccine from the CDC's immunization schedule for pregnant women and healthy children. A CDC advisory panel is set to meet in June to make recommendations about the fall shots. In a wide-ranging interview, former HHS Secretary Xavier Becerra, who is now running for California governor, sat down with To the Point to give his thoughts on some of the recent changes in health policy in Washington.
For measles, probably for measles, what I would say is my opinions about vaccines are irrelevant.
Health and Human Services Secretary Robert F. Kennedy Jr., an environmental lawyer with no background in medicine.
I don't think people should be taking medical advice from me.
Is a controversial pick to lead the Department of Health and Human Services. Founder and former chairman of Children's Health Defense, an anti-vaccine nonprofit, Secretary Kennedy has long pushed false claims about the safety and efficacy of vaccines.
News reports have claimed that I'm anti-vaccine or anti-industry. I am neither. I am pro-safety.
ABC 10 sat down with Xavier Becerra, former President Biden's Secretary of Health and Human Services.
The lack of respect for science, that politics is driving some of the decisions for our most important health agency in the country.
He's concerned about what he's seen in Washington this year.
Letting go some of the best scientists we have at the Food and Drug Administration means that next novel drug or medical device won't get out as quickly because we won't have the people there to go through the process of making sure it's a safe and effective.
As the Trump administration restructures the federal workforce, around 20,000 employees under the Health and Human Services Department have been laid off, offered early retirement, or deferred resignation programs.
Research, yeah! Research, yeah!
Agencies impacted include the Centers for Disease Control and the FDA, with more proposed cuts on the way. We know that California and many other states sued the Trump administration over these changes. What are your thoughts on this?
I don't see where some of these professionals can be just summarily fired and, one, have that be legal, but two, have that be sensible for the health of this country. It's not the way we should do healthcare. And, it's going to start to show.
Secretary Kennedy is also renewing public discussion around autism, backing claims that vaccines cause autism. RFK Jr. said this during his confirmation hearing.
I am not going into the agency with any.
Well, that's kind of a yes or no question, because because the data is there. And that's kind of a yes or no. And I don't mean to cut you off, but that really is a yes or no.
If the data is there, I will absolutely do that.
The secretary calls autism an epidemic, suggests individuals with autism are incapable of employment and relationships, and says his office will find a cure by this fall.
I am curious to understand how a politician who is not a scientist can say that by this fall, we're going to determine what the causes of autism are. I can tell you that when I was at the Department of Health and Human Services, there were no scientists who were telling me that by the fall of 2025, we would discover the causes of autism. But it gives you a window into the way the Department of Health and Human Services is run. And what I believe is happening, the only thing I can tell, is that the current secretary is allowing the White House and politics to drive the decisions that are made by a healthcare agency, when those decisions should be driven by the science and the data.
Well, what impact do you believe some of these statements can have, not only public perception, but also policy regarding autism?
Making it sound like nobody who has autism can do anything for themselves is unfortunate, and it deprives all those family members who are working really hard for those Americans with autism, the dignity and respect that they deserve for all the work they do for those they love.
Secretary Kennedy also mandated placebo-controlled trials for all new vaccines, describing it as a move towards greater transparency. While medical experts fear this could limit access to vaccines. How might this policy influence public health outcomes and also the nation's immunization infrastructure as a whole?
Well, it's as if he's taking us back to square one. There is no vaccine that's on the market that hasn't gone through trials, where there haven't been studies done where placebos were used. So I haven't heard the explanation why we have to go back to do something we did a long time ago. Because in some cases, the measles vaccine, for example, has been around for a long time. It's been administered to millions and millions of people.
And already been proven to be effective.
And it's proven to be effective.
So then why do you think it's happening? What do you think is the motive behind it?
I gotta believe that many of the medical and scientific professionals are more than scratching their head, probably pulling their hair out at this stage, because it's clear that science is no longer driving the decisions we make. And that is, it's not just a travesty, it's dangerous.
Under the Trump administration's proposed Big Beautiful Bill, the Department of Health and Human Services would be cut by over $33 billion. The Centers for Disease Control and Prevention, the National Institutes of Health and Medicare and Medicaid Services, losing millions in funding should the bill pass. The bill is currently in the Senate.